Hi, this is Fred Horne in the School of Public Health at the University of Alberta. A few months ago I was asked to contribute a commentary written from the perspective of a senior decision maker on the question of how well we perform in change management in Canadian healthcare. My mind drifted back to when I was first appointed as Minister of Health in Alberta in 2011. And at that time a colleague who had been a health minister at one time said to me, "Everyone will want you to fix healthcare until you try to change something." That's a thought that stuck with me in the ensuing 3 years that I served as minister and ever since. And in thinking about this article, I've tried to explore the question of whether the change management that's actually happening in healthcare today is connected to broader scale transformation in our health system that we've been talking about for years. These are issues like the question of expanding primary health care in the system, reallocating resources from facility-based care to community and home care, and really bridging the gap in terms of what we provide in our system by looking at the difference between what we actually do in healthcare, what the evidence tells us works, and what we actually pay for in the healthcare system. These questions, as I said, are not new and have stuck with us for a long time. But often I observed during my time as minister that people in healthcare are suffering from what I'll call change fatigue. There are so many different change management initiatives underway, and people are so pressed, obviously, with the responsibility of delivering high quality care to patients and improving outcomes, that change management initiatives become very quickly, for some people, I think, an annoyance, a top-down approach where people are asked to take on additional tasks without really knowing how that initiative is going to improve patient care, improve their ability to do the things that they want to do as a healthcare professional, and to support a better healthcare system for future generations of Canadians, their children and grandchildren. So this question is something I explore in my commentary. I talk really about two areas. The first are a potential agenda for transformation in Canada. Again, the ideas are not new, and I've referred to some of them. And secondly, I've explored the question of what enablers are necessary in a healthcare environment to make change management initiatives successful. And in this respect, of course, I'm thinking about things like the time and space for people to participate in change management work, the ability of leaders to successfully evaluate which change management initiatives are going to be transformative and which are not, the capacity of leadership to deliver a style and a substance in terms of their work that speaks to change management, our ability to integrate research and practice, very topical question today in healthcare, and some other things that I think are critical to our ability to improve our performance in change management. The old saying that change should not be for change's sake, I think, is particularly applicable to healthcare in Canada today. I hope you'll have an opportunity to look at some of my ideas and debate them and provide comment, and that the comments that I have offered will help us work together to provide a change management agenda for Canada that is truly transformative in nature, that speaks to better support for our workforce, better outcomes for patients, and better use of healthcare resources that are increasingly scarce in this country. Thank you.